Action.
Hi everyone, welcome back to another episode of Mrs. Diary with Roslan Foundation. It's been a while, right? Yes, that is due to the fact that we have PTS examination going on at Mese College of Nursing, and you understand examination pressure and preparation and all that. But we are back right now. So it is no longer in news in Nigeria that the current outbreak in Nigeria is cholera, and that is why we deem it fit that we should bring two important personnel to discuss about this cholera outbreak, to tell us what they understand by this cholera outbreak, how we can treat it, how we can prevent it. And today I have with me Ms. Onifade Soro and Mr. Femi Ayo. They will shed more light on this outbreak with us. And here with me I am Grace Akinyele from Mercy Medical University. So, Ms. Soro, can you please say hi to our audience, ma'am?
Greetings, everyone.
And Mr. Femi, say hi to our audience, please.
Good afternoon, everyone.
So, without wasting so much of our time, Ms. Soro, can you please tell us about the etiology of cholera?
Okay. Firstly, cholera is a bacteria.
Okay.
It is a small gram-negative curved root. That is the shape of that organism. It's like a cough.
Okay.
A cough. So that is how the organism looks like when you view it under the microscope. So this organism, it is a gram-negative root when you stain it. That is, it stains pink, or let me say a little bit red under the microscope. So that is the etiology.
Okay. So, and Mr. Femi, do you want to add anything to what you have said?
Yes, thank you.
Okay.
She's correct. That is the structure of the Vibrio cholerae, the positive organism for cholera. So, Madam is actually on the path. Thank you.
All right. So, Mr. Let's move on to the next question. So, can you please discuss on the epidemiology of cholera to our audience?
Epidemiology itself, it's a big word, a big context.
Okay.
Cholera has been in existence since the 18th or 19th century. It is known to cause pandemics and epidemics. Even it is endemic in Nigeria, in Africa, in Nigeria per se. And this is because it can be caused. Risk factors is when you live in a congested area, poor sanitation, or poor environmental hygiene, especially in our Africa where we don't have potable water or access to sanitation. So there are cell types of cholera, and we have bowel types of cholera. These cell types are known as serology types based on their antigen that they can be found. Although the cell types of cholera, we have about 200 cell types. But the two most common ones, the two types that cause infection, cholera in humans, are O1 and O139. And we have the bowel types, although the O1 is the most common one that affects humans. O139 also affects humans, but in fact, they even said it is not, let me say, actually not existent anymore.
Okay.
Alright. So the whole one has bowel types, what we call L2 or classic. You reminded me of something. L2. I remember I called one of my colleagues Alabi L2. Sometimes she just laugh. She doesn't know why I am calling her that, not knowing that we are heartbreak in Nigeria. So I call her L2 because it all looks like, when you are typing a research or this thing. But that's not the spelling of it. So it is E-L-T-O-R, L2. So I'm classic, okay? So this ETO also has the serotype that I'm saying. We have 3 serotypes. We have Inawa, I think Okawa, and then Ikojima. Alright. So these serotypes are known to cause pandemics in Asia because this cholera, I think it's originated from Asia before it goes down to Africa. So, and it is endemic in Nigeria, which are known to cause about over 11,000 deaths. Okay. I think about 2 years ago, that is 2022, because I could remember I taught my student public health surveillance on cholera. That is in 2022, as in January, the NCDC and WHO declared cholera as an outbreak in Nigeria. It started in Borno State, where about 43 suspected cases were recorded, although there was no associated death. Okay, and this in Yoruba, I think they call this cholera Aroni Bamiji, where the person will be defecating, stooling, and at the same time the person will be vomiting. And this thing, this cholera is very, very contagious, very, very communicable, in the sense that whenever you see someone defecating or stooling, the stool looks like rice water. You know rice water, when you wash rice, or you want to parboil rice, okay, that is how the stool looks like. Now you know there is need to call for an alarm. So that's the epidemiology. And the people that are risk factors are people that have underlying disease, people that are living in congested area, people that are displaced due to war, famine, droughts, a lot of things like that. So if that kind of outbreak is occurring in Lagos, you all know Lagos is a overpopulated, overcrowded.
Exactly.
So it is expected. Aside cholera, anything that wants to happen in Nigeria starts from Lagos because of the population, the environment, how everything is crowded. So now it started from Lagos. I think it's the CDC declared cholera as an outbreak in June. It said about over 200 cases were recorded, and I think 40 thereabouts. I can't hear this. I'm not following the trend actually. But as of now, it has been recorded in almost all the states. Because I could remember about last month, I saw in the news that Kogi have reported about maybe 10 cases or 5 cases or so on Punch. And I followed this thing on my Post Nigeria, WhatsApp. So I know the trends. I get little information there. So that's the epidemiology. So people that have low immune system, that have a stomach problem, they are likely to get this cholera because this organism infects the small intestine, and they can grow in acidic environments due to the fact that this organism, they releases toxin. All gram-negative bacteria, they release toxin. That is why they are very, very deadly. They are known to release toxins, so they are toxigenic. So when they release toxin in the small intestine, they can cause muscle cramps. When the toxins are released in the blood, they can cause muscle cramps, they can cause stomach pain, they can erode or invade the small intestine. So that's that.
You know, I never thought cholera can be this serious. I used to think like it's a normal disease, normal sickness.
No, it is
I never thought it can be this serious.
Mind you, this infection can be acquired by contaminated food, contaminated water, and the funniest thing is, it can majorly, you say this organism, it is acquired fecal. That is, when you defecate, this organism normally, when they are in the right amount of dose, they do not usually infect someone. It is the inoculum. If the inoculum is very, very high, your immune system can be overwhelmed, and then the infection occur. So when the immune system is not, overwhelmed, your immune system can control it. But let's say, for example, now, if someone defecates, and all this organism, I don't call it a normal flora. They are part of our normal system. So when you wash, you pass out, you do not wash your hands, and use that same hand to drink or to prepare food. It's like you are feeding yourself poison. You are feeding yourself what you are not supposed to feed. And unfortunately, this organism, they grow by binary fission. They multiply rapidly. So when they get to your system, they multiply. They have seen the environment for them to grow very well. So then they become what? In fact, about humans defecate about 10 raised to power 2 or 10 raised to power 6 of this vibrio in stools. So you can imagine, especially when you're now in an environment that is crowded, in hostels, in dormitories, in camps, refuges, and so on. And sometimes this thing can also happen in environments where they don't have a proper hygiene system. That is when people defecate, like short put, something like that can happen. And you happen to, maybe you are in environments where short put are practiced, and some people plant vegetables, tomatoes, something like that, and you harvest your crops, and you do not wash it very well. Especially people that like to eat raw vegetables, they are likely to contract so many diseases. People that like to eat raw tomatoes, Okay, so it is necessary you can parboil it or you can steam it or something. At least the cell wall of this organism can be neutralized or at least be partially killed. So something like that can.
All right, thank you so much, ma'am. Thank you. At least, you know, what I used to say one thing is, most at times, ignorance can kill. Because I never knew cholera can have this broad explanation. I used to see it as normal illness. So, moving on, Mr. Femi, can you please discuss with our audience the mode of transmission of this cholera? How does it work? How does it transmit? So we don't fall victim.
Thank you very much.
Yes, sir.
Most of the mode of transmission has been discussed by our seasoned epidemiologist. She was able to tell us how poor sanitation, open defecation, poor access to potable water, and lack of personal hygiene, like she mentioned, can actually improve the spread of cholera. As taking Lagos as a case study, the outbreak must be due to obvious overpopulation of Lagosians, or of Lagos rather. And if you look at the Lagos metropolis, you will have the belief with me that most areas in Lagos are shanties, and of course, without a good hygiene system, which like markets, garages, some localized
worship centers,
swamps, even worship centers, some schools too, without proper hygiene system. So, and you know, cholera is just like Madam said, it's a disease outbreak that has to do with oral fecal route, that is from the hand to the mouth. What you pass out of your body, and you use your hand to clean your body, and eventually you fail to practice safe hand washing techniques, and you cannot, you probably forgot, or you didn't wash your hand before using it to take something back, or you use it to touch the doorknob, you touch other things at home. We call those ones vehicles. So yes, other people, unknowingly to them, touches the same knob as you did, may also get infected with this bacteria.
And
so that is the main
mode of transmission. And you know, taking Nigeria for instance, you know, most of us, every ailment, we classify them as malaria, even when they are not even malaria. So how do we identify, like, what are the signs of symptoms of cholera? How do we know?
Okay, thank you. Fine. Even some of the signs and some of the symptoms of cholera too might mix some of those that will manifest with malaria, like fever, like vomiting. So be specific about cholera will cause what we term as gastroenteritis. So yes, because it involves, just like she said, there will be vomiting and passing of excessive wateries through, happening simultaneously. So Yoruba believes that there will be one can in front collecting the vomitors and another can at the back for the stool. So those are the symptoms. And the other one is abdominal cramps because of the colonization of bacteria in the intestinal tract. Yes, thank you. Muscle spasms too. There will be loss of appetite due to excessive electrolyte loss in the body, because at the first time the patient is going to have this watery stool, about 1 liter of fluid might be lost. Yes, it is true. And they pass to like 250 grams per kilogram body weight every time they pass stool. which comes frequently. And you know, this too now comes with the body electrolytes, which is going to run the patient into a situation we call hypovolemic situation, which may eventually lead to shock. So these are the clinical manifestations of cholera.
Okay, sir. So what are the treatments for this cholera?
Okay, thank you. Basically, in 1973-74, when we had this outbreak in Nigeria, most families were bereaved of their loved ones because there was no hand-on management ideas about what the cholera outbreak was then. Like in the family, about 5 or 6 dead bodies might be buried, and that time it was very endemic that no family is coming to pity or show sympathy on the other because everybody is burying somebody. So that time, because it was a sudden thing, and the hand-on management techniques were not really in place then. Now, what we do now is that the first thing is to replace the fluid. There you call it rehydration. You have to rehydrate the patient. Yes. If at the beginnings, at the onset of it, you tell the patient to start taking ORS, oral rehydration salts, which contains a portion of salt and sugar solution, which is believed to be replacing lost fluid in the body. Yes. So then we have injections. We have injections like paromomycin. We have streptomycin. Those ones they belong to the class of drugs we call sorry, that is evading me now. They are aminoglycosides actually. So they are very effective against cholera. Then we have metronidazole. It's also being used to take care of cholera. The progression of it. We also have another. Recently, there are drugs that falls into the group we call quinolones and fluoroquinolones. Quinolones are drugs like pefloxacin. Fluoroquinolones are streptomycin. They are ciprofloxacin, sparfloxacin. All of these ones will come and together with the use of the aminoglycosides to combat and give quick control to the progression of the viral cholera, which is ravaging somebody's system at the point of admission to the hospital.
Okay. So, Ma, before we go, can you help us, at least if we are in a situation, maybe we have someone suffering from cholera, and at least maybe before we get medical attention, how do we stabilize the person? At least maybe from home remedies, how do we help so that we may avoid complicated issues?
Number one, let me tell you something. If you notice or you observe that someone has an infection, and based on what you would have heard from CDC or WHO, and you know that this person has similar symptoms to cholera, number one, isolate that person.
Okay.
Because it is a communicable disease. Secondly, contact your local authority, be it a private hospital or state hospital or primary care center that can contain that infection. Okay. So they know what the necessary steps to take. They can test you to be sure that you don't have the infection yourself. Okay. And then they know the necessary action to do to the person. So from there, they can take over. They can take the person to the, of course, they take the person to the clinic and do the necessary things, treatment and the management. And also, if there's any awareness or any strategies they can do in that environment or the area, they can implement that.
Thank you so much, sir. Thank you so much, ma'am. I believe everyone has learned something.
One more thing, sorry to
Okay.
this cholera is also prevented by vaccine.
Okay, so that's the vaccine as well.
Yeah, there's oral vaccine.
Okay.
There's oral vaccine they can take. I don't know if it is very distributed in Nigeria, but I know there's an oral vaccine. And one thing I'm afraid of is this flooding in Lagos. I hope it will not increase
That's true.
I hope it will not increase the cholera outbreak in Lagos, because normally most areas I'm sure they don't have in potable water safe. Now this flood has, I can't even areas that I do not expect if I heard that it affected them. So now imagine those floods that have carried a lot of particles, a lot of only God knows, and it still mixed with water they drink and
Yes.
I pray the suspected cases will not rise.
Thank you so much, ma'am, and thank you so much, sir. I believe everyone we've learned so much today. We've learned, even especially to people who are in my category, that we don't take things with everything else. We believe in it's cholera now. I believe we've learned something new today. And our own viewers, let us do well to prevent cholera outbreak. Let's, after visiting the toilet, wash your hands properly. Let's cook our food very well. So those of us who love vegetables and raw food, let's cook
They have
them
food,
very well.
too. Please make sure you take care of your wound properly.
Exactly.
Because cholera
Open
can
wounds.
also cause blood sepsis.
So, you've heard from our guests. Treat wounds very well and don't take anything for granted. If you feel anyone is probably having the symptoms of cholera, call the appropriate authority. And thank you so much. Bye.